Hi, with Kelly Wilson of the Wilson team, and I wanted to bring you guys an important message about something that means so much to me. I don't discuss it enough with my clients, but what prompted me to bring one of our experts on is the fact that I did receive an email. We've got Colin Keddy with us, and he runs a local financial consultant office in Ottawa, Synergy Family Office. But one of the emails that I received today through all the midst of COVID was about insurance. And it got me really thinking about just people and planning. And that's what our team is all about, is trying to understand sort of the bigger picture and not just about building wealth, but using insurance as part of that plan. And so many people are lacking the information around it. And if what has happened has brought anything to light, it is what we see as a lack of, right? So resources that we don't have, planning that we don't have in place. And it's probably never been a better time to discuss this, and especially with the email that came out, we're saying insurance is now looking at the premium rates going up. So if you're somebody who was thinking about it or wanting to look at this as part of your plan, and we'll get into why it's so important in my family, we want to make sure that you're maybe looking at it before the premiums start to go up. And I think, Colin, you were saying April 20th was the date, but I'll let you talk a little bit about why you wanted to make sure that that email went out to everybody and all of your clients today.
Sure, happy to do so. Thanks, Kelly, for having me on. So about a month ago, I reached out to one of the largest insurance firms in Canada, to my contact, with some assumption that, down the road, obviously what's going on may have some effect on premium rates and so on and so forth. And so we had speculated at that time, about a month or maybe even as much as 6 weeks ago, that the premiums would likely increase within the next 2 or 3 quarters by the end of the year, at the very least. And so early this morning, I just got a phone call from that same individual, and they said, well, it's not going to be 2 or 3 quarters on our living benefits. So that's your disability and critical illness, things of that nature. The rates are actually going to go up April 20th at midnight. Now, this is only one carrier, but I would suspect that you tend to see these guys, move the same way. Once someone sees that, they'll follow suit. Not much different than what happens in the mortgage industry. Mm-hmm. So, but I think the reality is, especially when it comes to living benefits, the rates were bound to go up sooner than later. I think this is just the straw that broke the camel's back, as they say. The reality is that when it comes to critical illness, most of the coverages cover 32 different types of coverage. Obviously, the cancers being the big one, and stroke and things of that nature, heart disease. But this is affecting one in 2 people now. This isn't an insurance that you're going to use. The likelihood is extremely high. So like I say, this is just sort of the straw that broke the camel's back. And then when it comes to things like disability insurance, very stressful environments, people losing their jobs, not being able to get out. So, the mental effects of what's going on, there's a great expectation this is going to push the rates. And you do make a great point in saying, this is the circumstances, this is maybe the best time to think about it. And I think the reality for us is there really isn't a best time, but it's under these stressful situations, that people start thinking about things. Sometimes people have a life event where, it triggers them to do their will or power of attorney. So certainly this is one of those things where, we're all hypersensitive, to critical illness, especially. And it's interesting because a lot of the discussions that I'm having, and I got actually quite a bit of response back from that email. Hey, yeah, I've thought about it. Let's have the conversation. Let's get an application underway with the increase of rates, and the anticipation will be around 10% as a minimum. As long as the applications are in before the 20th, we can move that forward. But what's interesting, and this has been a conversation long before this circumstance, is what I think people don't realize, oh, yes, I got disability at work, so not a big deal.
Mm-hmm.
If you get a critical illness, that doesn't mean that you're disabled.
Mm-hmm.
And so that's a huge issue. Simply being diagnosed with cancer does not mean that you cannot work.
Mm-hmm.
And so with an already stressed out healthcare system, people, huge waiting lists. As you know, I recently broke my leg and they could not look at me for 24 full hours before they'd even give me a consult. So the hospitals are backlogged and everything else. And what critical illness does is, when a diagnosis is given, that money's paid out immediately and you can do whatever you want.
Mm-hmm.
If you wanted to jump on a private jet and go to any country that, there's a number of different, in Germany, actually had a client go over for some very customized cancer treatment, and, he could afford to do so. But, most people would not want to reach into their pocket and totally wipe out their retirement savings, for something like that. So you end up with people here in the Canadian system who will sit for 6 months, a year. Well, I'm sorry to say, but, your illness in all likelihood could get quite a bit worse, or, worst case scenario is that you pass away.
And so the reason I, loaded up with critical illness for me isn't, you have the obvious, which is it will help pay the bills while you're sick, while you're recovering, while you're trying to get better and be with family and be at home. But the bigger thing to me was actually a subsidy of healthcare. That was the biggest driving force. And I think that people don't see that as like, okay, what is medicine going to cost in 10, 3 years, 5 years, right? Especially when we see what's going on right now and the pressure that the economy is under, is how are you going to afford to see a specialist? How are you going to afford? And I had a prime example was a few years ago, we had a friend that actually got sick, went to see very rare cancer, went to see somebody in Ottawa hospital. They couldn't do the surgery. They, recommended it to Toronto. They wouldn't do the surgery. So ended up finding a specialist in the US, 43 years old with a family of 3 kids, and $527,000 later, it saved his life.
Yep.
That was the difference between life and death for him. And so I see that, and I don't want to be deciding between my house, do I put everybody on the street, or do I have a nest egg to be able to carry me through that and weather that and be able to pay for the specialist that I need at the time. And, we have a lot of people say, oh, our healthcare system is really great. I'm not disputing we have a good healthcare system, but it's how sustainable is it over the next decade, 2 decades, 3 decades, right? And we start to see slowly as things being retracted and removed out of what we're actually being covered for. Respite, there's a huge one.
There's rumblings of potentially moving to a 2-tier healthcare system. For those who can afford it, maybe they should be paying for it. And I don't, I guess fortunately, unfortunately, here in Canada, we are so blessed to have such a great system. No one's really worried about that. In the US, and not a lot of people know this, the number one statistic that bankrupts people, or the number one thing that bankrupts people, the statistic is, it's healthcare treatment. And so, yes, we have a decent healthcare system, but can you get what you want quick enough? So, your example that you just provided, is a great one. And, we tend to have so many different things to, luxuries in life. One luxury we can't afford to be without is our health. So, no question. And I think the reality, and when we are going to see more and more, that people are going to have to go elsewhere, especially if we, our healthcare system, continues to be as stressed as what it is.
Yeah, and even going down to your children, if you buy critical illness for your children today, think about how inexpensive it can be, right? But you're protecting that child right from that age. So if any illness creeps up or has, potential of seeping in later, or they get sick or anything happens, and they have no protection, they can't even apply for it, right? The exclusions will be so far out of whack, that they won't be able to afford any type of insurance because they won't get any. They'll be declined, they'll be denied. And the other aspect is for your children is that if they get sick and there is some opportunity to have money, then you can afford to stay home with your child.
Well, exactly. And that's, you got to think about all the costs that go with this, right? It's not just a question of, well, you've got to leave, you've got to leave the country, or, your child's got to leave the country. You've got to go with them. And so in many ways, I mean, life insurance is so extremely common. It's like, do you have life insurance? Oh, of course I do. Well, the reality is, financially, sicknesses and disabilities are more like a living death. You're still around, and now your expenses have increased. Well, if you weren't alive, there wouldn't, I mean, you'd have final expenses, and that would be it. So, with disabilities and critical illnesses, it tends to really wreak havoc on expenses. And the other thing with with the critical illness, almost every carrier has a program that's called Best Doctors. And some people will be familiar with that program because it used to be a standalone program. You could actually purchase this. And what it meant was that if you had a medical concern, or actually anybody in your immediate family had a medical concern, that they would take they generally put together a team of 7 people around the world, the best people who, whatever your circumstances is, those 7 people would triage your case and then figure out, not only now, okay, you have this money to deal with the resources, but you're actually getting assistance from the best minds on earth. There's about 50,000 doctors in this exclusive program that provide this service. So it doesn't always mean you necessarily have a critical illness. Maybe you're just not feeling well and you want a second opinion. So someone who has that critical illness, has that ability, because again, you're going to want to go get these tests or exams, and you're going to be waiting months, if not potentially, years.
Right. And I think I was speaking with somebody that was saying, they were at an insurance conference, and they said, if we go back 30 years, it's 1 in every 25 people had cancer. It wasn't the normal. Yeah. And today, I thought the numbers were 1 in 4, and the insurance, I guess, company said, look around. It's 1 in 2 now. Like, this is where we've come to in the last couple of decades. So if you don't think if you think it's expensive now, then I can't even imagine once the next couple of years goes by, and then again, the impact on the healthcare system with all the baby boomers coming into retirement now, which represents such a huge portion of our population, right? Yeah,
I think eventually, and there is a real possibility that it will be so priced out of the market that it might not exist whatsoever. And you're absolutely right. I mean, these things are skyrocketing. As I said, it's not really a question of if, it's more a case of when, unfortunately, but that is the reality. So I'm not surprised that's the feedback that you received.
Right. And I think younger people need to start looking at it while they're healthy, because we never think about it until something happens, and that's always when it's too late. Yep. And, a lot of people think they have it through work. That's the biggest misconception I hear, is when people are calling saying, no, I have insurance through work. I've got, do you know how much? No. But, maybe it's 6 months of pay. Maybe it's $25,000. Maybe it's, 50 for life insurance. But most people don't have a clue what they have. They don't really understand their coverage, right? Maybe speak a little bit.
Yeah. So, and that's the issue with living benefits. And so again, talking about the critical illness and the disability insurance, you're obviously still alive, so it's not clear cut like death. If you die, the insurance pays out, that's quite straightforward. So where in the case of living benefits, you're right, there are so many different things, whether, you're actually covered for own occupation. So like in the case you were saying, I have group insurance. So people who have group insurance will typically have an own occupation for the first 24 months, and then it will go to any occupation. So that literally means, if you were a lawyer in a law firm and 24 months later you were physically capable of flipping burgers, that designation of own occupation changing to any occupation, would affect that individual. And there's all kinds of different riders, whether, it's got cost of living on it and so on and so forth. And the reality is there is no insurance that covers 100% of your expenses. The reason being is, in respect to disability insurance, the reason being is if there was almost an incentive for you to be disabled, it would be, it'd be a negative outcome for the insurance company. So they obviously don't want you to have more coverage than you have for income. So I think it's important that people are hypersensitive to the idea of, does this have cost of living built into it? Is this for, own occupation or any occupation? When does my benefit start? Because the reality is, with living benefits, in all likelihood, you are still going to have an adjustment to your standard of living. And again, with critical illness, and you said, starting these plans early, many of these plans have like a return of premium on them. So, hey, listen, if you do manage to make it through your 50s and 60s and you're healthy, and this is one of the major things, I think we all know that, it's been discussed for quite some time. Hey, people are living longer, but as you said, with this, with such a onslaught of disease, now the question becomes, are you going to make it through that time frame of, say, 45 to 65? And if you do cross the hump, if you can, get through that narrow gateway, chances are that you will live longer than, what our ancestors had been doing. But it's getting through that part of it. And like I say, for living benefits, there are so many different options. If you think that your work has it and that's enough, I would question that. The other thing that, will be hugely in question for a lot of businesses right now, as cash calls are so tight, when they look at where they can cut expenses, it's very common to see companies drop their health benefits because they can, and they're the one in control of that, not you.
Mm-hmm. Yeah, actually, you make a really good point. I know the reasons I have coverage. I have built my plan around assets, but also leverage. And the life insurance is supposed to be there to protect all of those assets going forward. I know a lot of people say, well, I've got mortgage insurance. So I'm not a big fan. I don't like it. I don't recommend it. I feel like if you're going to do absolutely nothing, then sure, it's something. However, if you are somebody walking around with mortgage life insurance, then you really need to look at reallocating that, because what you've done now is you've tied any security that you've had to the bank's loan, not to you or your family, right? So all you've done is cover that. It's a declining balance. That's number two. So it doesn't protect you for the full amount. So it certainly doesn't hedge you against any inflation. That's for sure. Mm-hmm. And the other reason is if it's tied to that loan or mortgage and you move or you change or you pay it off, what do you have left? Your house is never, we're trying to teach people that your house is not your savings account. Yeah. Right? It's your shelter. Yeah. Right?
Yeah. And like you say, if someone's dealing with a broker, there's a good chance that you're going to find a better rate at another institution. And, again, going, with critical illness, maybe something's come up and you go from, whether it's TD to RBC or wherever, you can't take it with you. I mean, it belongs to that other institution. So, chances of decline and everything else. And quite frankly, I would say that more often than not, privately purchased insurance, especially when we're talking about things like as inexpensive as term insurance. And first and foremost, you want to make sure the need is covered before you get into, these fancy riders of return of premium. And, you and I've had numerous discussions about, insurance as an actual asset class. And it's certainly something used by the wealthy, as a tax management tool for actually building wealth, not just for the person who's going to receive it, but for the individual who will use it for their own purposes. Probably another discussion for another day. But yeah, I think if you're leaving your insurance in the hands or the control of somebody else, well, then, that person, and even a bank could turn around and say, listen, we're not doing coverages anymore. They control that. So it's, It's definitely for something that, the irony is not lost on. Insurance is to cover a risk. And
Mhm.
so if you're putting it in the hands of somebody else to control it, you're taking quite a risk.
Mhm. So, like I said, I've got anybody in my immediate family has their children covered for life and critical illness, and they are full policies. And people sometimes look at me and they say, "Well, that's kind of morbid, right?" I said, "No. If they get, number one, in protecting them for the rest of their life, number two, if they get sick or something happens, how do I go back to work? I can't.
Yeah.
I have to be there for my child. Could I even go back to work if something devastating happened? No. So it's not, it's sort of twofold. It protects them for the rest of their life, and it protects me being a parent, right? Being able to care for them. And then
Yeah.
the same thing goes for the reasons of the critical illness. And far too many times do I see, I mean, it's almost everybody that I talk to. It's everybody's been around somebody that's been sick or has passed away, and the ripple effect of what ends up happening and the lack of resources that are available, and for maybe the difference of applying and getting these policies in place, it just takes away all the stress and heartache and gives you choices and gives you options and leaves something there for other people, including being able to take for yourself. What does it cost just to go to respite right now? If you need to, like just to go into a care home, maybe while you're fighting cancer right now, and it doesn't mean you are destitute. And I've got, an example of a good friend of mine right now that's struggling through cancer in her 40s, and the cost to go into a nice facility while they care for her. And everybody, not everybody can take on somebody that has, been disabled that way, because number one, they might have kids at home. They can't care for the person. They have stairs. They can't get up the stairs. They, where is that person going to sleep if they're not mobile? So all of these things, are floating around, and what are they running? I mean, we were seeing quotes of $5,000-6,000 a month, plus the
Yep.
nurses, plus the
And that, yeah,
PSWs.
yeah. And that's the mid market. When you get into the upper market, you could easily be, $7,000 to $12,000 a month for the very high end places. I mean, there are, I have a good friend of mine, one of my business partners, and his mother, is here in a suite. It's not crazy. I mean, I think it's somewhere around 600 square feet, and it's $12,000. It's $12,000 a month for her care.
Mm-hmm. And I think that's what people miss the boat on, right? Is they're not really seeing the bigger picture until they're faced with it and they have to do it, and they start making phone calls and realizing,
Yeah.
who do I need surrounding this person?
Yeah, and unfortunately, and I think what people need to understand, and like I say, it tends to be difficult and stressful times such as these, where it gets people thinking. And the reality is, if your house was on fire, how much coverage would you want to have? The
Mm-hmm.
answer would be everything that you could get your hands on. But the issue is you can't buy insurance when your house is on fire. I mean, it's the event has come. It's happening. So, and I think it was interesting. I was actually quite surprised how many people reached out and said, yeah, I'd like to get this sorted out. And interestingly, as it is right now, obviously, medicals are cannot be done. Certainly, as far as the invasive side of medicals, whether that's the direct tests or nurse coming out to meet people. So the insurance companies have actually, laxed the evasive side of the medical. So if they can get a good, clean app and a decent doctor's report, people are being able to put this insurance in place pretty quickly. And like I say, specific to this one carrier, if they receive their application prior to the 20th, just the fact that the application is in, provides that security. I think that's somewhat similar to what exists, in the mortgage industry. You just want to get it posted, and if the rates go up thereafter, you've still managed to catch it. So it's the same thing. And I don't think that really should be a driving factor, or even the current environment that we're in right now. With this pandemic, the reality, as you said, I mean, all of these things have rocketed as far as, the illnesses and even mental issues as it relates to depression and everything else. So but unfortunately that's the way that it is. It's times like like these where it gets people thinking and eventually making decisions to deal with it. But I guess that's kind of human nature, right? When we're in our comfort zone, we're comfortable and we want to enjoy. But this is one of those things. You get it dealt with, you put it behind you, and then go live your life.
Yeah, and I, obviously it was concerning enough for me to try to get you on a Zoom call today to talk about it. Yes, I do have coverage, but when I'm dealing with clients on their finances and going through their whole, budgeting and planning to try to, rearrange and restructure, to me, the most important is insurance. We have it for our cars, we have it for, our houses, we have it, but we don't have it for our lives.
Yeah.
It's mind blowing to me. And I know people say, well, I can't afford it, it's expensive.
Yeah.
And I hate the cliche, it makes me crazy, but if you can't afford to pay for, you can't afford not to have it, right? I mean, that's
that's
the reality of things.
Yeah, that is exactly it. And 25 years ago when I started in this industry, and I mean, it just seems so cliche where people would talk about insurance as the foundation of a financial plan, and you spend quarter of a century in this industry, and I probably had close to 70 death claims over the course of that time frame. You just realize, it's not a line, it's the reality. It is the foundation. And again, I mean, you don't want to be, insurance rich and investment poor. I mean, there needs to be balance there. But it is something that needs to be dealt with because you can't fix it after the fact.
No.
It's just not something that is fixable. You can get sick and still invest money.
Mm-hmm.
There's a lot of things that you can do, but insurance, when whatever the event is that happens, generally there's not a lot of recourse. And even if someone goes into remission and they have it clears up, the chances of whether they're going to get that insurance standard or not ever again in their life, it can be slim to none. And as you said, with kids, what I've seen a number of times over the years is clients, who have, different things, diabetes, or they've had some sort of experience like stroke and so on and so forth. And their parents had bought them, guaranteed insurability for, into their adulthood, and they're using it.
Mm-hmm.
Certainly that person, tends to understand the value because they're living it.
Right. And if you feel that you can't afford it, then we want to be able to show you, ways that you can. We will find the gaps. We will find it. I'm so passionate about it. And people are just not educated on how it covers you and the power of what it can do and change your family's lives. So we will help you. We will go through all your finances. We will find it and we will figure it out. And like Colin said, you don't want to be doing this when it's too late. And unfortunately, just the last couple of years, the amount of people that are my age group, my friends, that have suffered some fairly significant health issues, heart attacks, strokes. These are people in their 40s. And, whether it's the stress of the day-to-day now, regardless of it is, those people now cannot go back and get insurance. It's too late for them, right? It's too late.
Yeah. And it's everybody when it comes to, not wanting to make that investment into insurance. And I can tell you, and I'm going to deal with a number of high net wealth clients. And I think this is sort of a human tendency too, where, when people think about where they want to put their money, they want to invest it. They want to see it grow. You look at insurance as something, well, that doesn't grow. Which isn't always necessarily true. And so I think that's great. You try to help people find out where that is. One of the things I do with my high net wealth clients is I say, listen, if we could reduce your income tax, would you be willing to take your tax dollars and pay for all your insurance? Which of course, everybody's happy to, I'd rather, buy insurance than give the money to CRA. So there's all kinds of strategies, if you have if there's a will, there's a way, to find the means of making that, covering that cost for sure.
Well, thank you very much. That's been very informative. We are going to pass along your email to all of our database and client list as well. And I know it's Easter weekend, so hopefully you get some more quiet self-isolation time, I guess you could say.
Yeah, absolutely. All right. Well, enjoy your weekend. Thanks for having me on. I appreciate it. And I love your shoes.
All right. Yeah, thanks.
Okay.
Take care.
All right. Bye-bye.
Bye.